You can try to hold back the wave, but they will always wash upon your feet. Two waters flow with a barrier in between, the salty sea and rivers fresh and sweet. Two waters flow with a barrier in between.
Bismillah, wassalatu wassalamu ala rasulillah. Dear brothers and sisters, welcome and assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to a brand new episode of Contemporary Fiqh Issues. We have with us again our guest, Shaykh Al-Fadil, Shaykh Assim Al-Hakim04. Shaykh Assim, welcome.
Jazakumullah khair, and thanks for having me.
Shaykh Assim is a well-known speaker and da'i who has traveled extensively across the globe, giving lectures and motivational speeches on different subjects from fiqh to aqidah, and he is the khatib and imam of a masjid in Jeddah, Saudi Arabia, and has been in such a position for the last 21 years. Today, inshallah, we'll be discussing the issue of reproduction with our shaykh. But before we go on to the discussion, inshallah, we'd like to just show a report with Dr. Ihab Samaha. Let's go to the report, inshallah.
Allah Ta'ala, Allah Ta'ala.
My name is Ihab Samaha. I am a lecturer and consultant of obstetrics and gynecology. Today we are going to talk about IVF, which is an abbreviation for in vitro fertilization. But before getting into IVF, we have to do a very small introduction about infertility. Infertility can be divided into primary or secondary infertility, and it is defined as primary infertility actually is defined as inability to conceive during or after 1 year of marriage, and its instance is about 10 to 15% in couples, in all couples, during their reproductive years of age. Fecundability, on the other hand, is defined as the ability to conceive. And the ability to conceive is about 20 to 25% in all couples during their reproductive years of age. About 50% of all females during their reproductive years of age will get pregnant during the first 3 months of pregnancy, of marriage, and about 75% will get pregnant in about 6 months, and more than 85% will get pregnant after 1 year, after 1 year of marriage. Of all these 10 to 15%, half of them will get pregnant spontaneously during the 2nd year of marriage. There are many causes for infertility. It could be ovarian causes like polycystic ovarian disease, like hypothalamic pituitary dysfunction, like uterine causes, like tubal causes, fallopian tubal causes, endometriosis, and treatment is usually is really variable. It depends upon diagnosing each case. But at the end, we might need to do an induction of ovulation. It's one of the line of management. Or we might need to do what we call ART, or assisted reproductive techniques. Assisted reproductive techniques can be subdivided into egg and embryo cryopreservation, testicular sperm extraction, pre-implantation genetic diagnosis, intrauterine insemination, and IVF. There are many types of IVF, like what is called GIFT, or gamete intrafallopian transfer, and second type is called ZIFT. It's zygote intrafallopian transfer. The third type is called ICSI, which stands for intracytoplasmic sperm injection. In order to do ICSI, or intracytoplasmic sperm injection, we have to prepare the female by controlling all her hormones. We give her drugs to inhibit all the endogenous release of hormones from the pituitary and from the ovary until we reach multiple ovums from the ovary. Then we do what is called oocyte retrieval, and it's done can be done under general anesthesia or local anesthesia or without anesthesia. We use a vaginal ultrasound to aspirate the oocytes. Then we take the oocytes to the lab. Meanwhile, we should have a specimen from the husband, whether it's from the semen or from the testis, if there are any abnormalities in the seminogram of the male or the semen analysis of the male. Then we do the intracytoplasmic sperm injection in the lab. And after some time, we have to do what is called embryo transfer. We get the embryos which were prepared in the lab, and we put them inside the uterus of the female. 15 days later, we do what is called a pregnancy test to see if she's pregnant or not. After preparing the embryo in the lab, we do what is called embryo transfer. We inject the embryos inside the female endometrium or inside the female uterus. 15 days later, we have to do a pregnancy test to see if the female got pregnant or not. And it should be noted that the incidence of success of ICSI is about 30 to 35%. The second point that we should talk about is what is called surrogate mother. Surrogate mother, it's one of the lines of management of infertility if the female got any problem in her uterus. For example, if she got a hypoplastic uterus, which is a small uterus that she cannot get pregnant at all, or if she had done a hysterectomy for any reason with the sparing of the ovaries, we can get embryos from, we can get oocytes from her ovaries and semen from her husband. Then we prepare for IVF and inject the embryos inside another uterus or a uterus of another female. That is what's called surrogate mother. It also can be used if we have frozen embryos or cryopreserved embryos or eggs, can be used after death. We can get the semen from the father and the frozen embryos and inject them into a surrogate uterus.
Allah Ta'ala, Allah Ta'ala.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We have with us Shaykh Asim bin Luqman Al-Hakim. We just saw the report, Shaykh Asim, by Dr. Ihab Samaha regarding the complications of reproduction and how to deal with them. If you could elaborate for the Islamic issue on reproduction or having children and how this relates to Islam.
بسم الله الرحمن الرحيم الحمد لله رب العالمين وصلى الله وسلم وبارك على عبده ورسوله الأمين نبينا محمد وعلى آله وصحبه أجمعين. First of all, we have to understand that whatever state a person is in, it's because Allah Azza wa Jal's judgment for him was for the best. Yet this does not mean that we should not strive and do our best to change it within the boundaries of Islamic laws. Allah the Almighty tells us in the Qur'an, to Allah belongs the kingdom of the heavens and the earth. He creates what He wills, subhanahu wa ta'ala. He bestows female offspring upon whom He wills, and bestows male offsprings upon whom He wills. Or He bestows both males and females, and He renders barren whom He wills. Verily, He is the all-knower and is able to do all things. So, it is up to Allah Azza wa Jal whether to grant and bestow children to people or not. Having said that, Islam encourages reproduction. Islam encourages life. And we are instructed in Islam to marry a woman who is fertile and who is able to reproduce, because this is the essence of marriage. As the Prophet said, alayhi salatu wasalam, marry the one who is loving and fertile, for I will feel proud of your large numbers before the other prophets on the day of judgment. So this is part of Islam, that we marry someone who's fertile and is capable of reproduction. And one would ask, how would we know that if she's fertile or not? Well, this can happen by two means. The first one is that we know that she comes from a family that has no problem in this field. So her mother, her sisters, all have children and they have no problem in reproduction. The second way, or the second means, is that this woman was widowed or divorced and she already had children. So then, now we know that she is capable of reproducing.
Barakallahu feekum, ya shaykh. We'd like to continue, but we have to go to a break. Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Allah Ta'ala, Allah Ta'ala, Allah Ta'ala.
Virtues of Ramadan. The month of Ramadan is the best month of the entire year according to Islam. It has many virtues that Muslims should benefit from. Do not lose the chance of this blessed month and join Dr. Assim Al-Hakim04 in his program Virtues of Ramadan.
Ramadan is a very unique opportunity for all of us. It is a very unique occasion for all Muslims all over the world. We are going to discuss certain issues related to Qiyamul Layl and how to observe the night prayer. We are also going to speak about zakah, insha'Allah. We are going to speak about sadaqah.
Virtues of Ramadan in Ramadan on Huda TV.
Allah Ta'ala, Allah Ta'ala, Allah Ta'ala.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. Shaykh Asam, we were just discussing the issue of reproduction and the benefit of marrying a woman who can have children and can bear children, and the doctor, Barakallahu Fi, was talking about the issue of some people who have trouble conceiving children. As we understand, Islam has divided this into different categories. Could you please expand upon what those categories are?
Well, the scholars have gathered in the Islamic Council of Fiqh, which is part of the Muslim League organization. Mm-hmm. And they came up with a number of categories. And these categories they've reached after consulting physicians and doctors, and they deliberated a lot on these issues, and they came with a number of types. So they say that the first one is when the fertilization is taking place between a sperm and an egg from a woman that is not the wife. So they take the sperm of the husband and an egg from another woman, a donating woman, and then they take the embryo and they plant it in the womb of the wife.
Okay.
This is the first way of doing it. The second way of doing it, that the sperm of a man who's not the husband is taken to the egg of a wife, and then they would take the embryo and plant it in the womb of the wife. And similarly, this is done widely in the West, where they have what's known as sperm banks.
Yes.
So if the man is unable to produce his own sperms, they just go and take it from anyone.
Any Tom, Dick, and Harry.
Anyone.
Yeah.
And then they would do this. The third procedure is that they would have the sperm of the husband, the egg of the wife, and cultivate it, and then take it to a surrogate mother and plant it in the womb of a woman.
So now the child of two individuals is being born in another individual.
Yes. The fourth, and this leads us to hiring the wombs and having women, surrogate mothers, doing this for money. And this is a big trade in the West, and we've heard and read a lot of the stories where the woman, at the end of the day, changes her mind and says, no, I'm going to keep the baby. I conceived it for 9 months, now I don't want to give it away. And the parents are saying that this is ours. It's our DNA features in it. It's the man's sperm and the woman's, the wife's eggs. The fifth one, or the fourth one, is when this is done in the wife's womb, but with the sperm and the egg of two different people who are not related to the spouse.
Okay.
The fifth type is when the two husbands, the two spouse, the man's sperm and his wife's egg are cultivated, but then planted in his second wife's womb.
Okay.
So it is the husband's sperms, but it is not the wife's egg. It's the second wife, the co-wife's egg.
It's the second wife's egg or the second wife's womb?
He has two wives.
Okay.
One of them does not conceive. So he takes the egg from his first wife, and then he puts the embryo in the second wife's, so that she would conceive and bear children. And the sixth and the seventh are permissible. But all what was mentioned above was not, or is not permissible. Because the origin of the sperm and the egg must come from the man and the wife. And the person conceiving this embryo is, or should be, the wife herself, not the co-wife, not a surrogate mother, not anyone else. Now they have a sixth and seventh procedure that they say this is permissible, and that is that the sperm is taken from the husband, the egg is taken from the wife, and it's being cultivated externally, and then the embryo is planted in the wife's womb.
So basically it's taken care of in an outside environment and then planted in the same wife's womb.
That's true, because it could not have grown there.
Okay.
The seventh one is that they take the sperm of the husband and it is carefully injected into the wife, and by this, because this is done when the husband is unable to have normal intercourse or is unable to deliver his sperms to the right location, and this is also permissible.
And this is probably the closest to the natural way.
Yes.
Barakallahu feekum. What would be some of the shortcomings or some of the dangers of mentioned procedures? You mentioned about 7, and you mentioned that the first 5 are all haram, according to the scholars, and the last 2 are the only ones that they saw permissible. What would some of the dangers be, for example, with even the last 2?
Well, there are a lot of dangers surrounding this procedure. And by saying dangers, it's not life-threatening. It's even worse, because it would mean that the lineage would be mixed and people would come into families that they're not theirs.
It would cause a similar harm to what fornication has caused, for example.
Exactly. And that what caused a number of scholars to forbid all these 7 procedures altogether and say that if you measure the pros and cons, if you measure the disadvantages and the advantages, you would find that it is not an issue of necessity. It's not a life-threatening issue that would permit us to allow this. Yet, the majority of scholars say that the 6th and 7th procedure are permissible, providing that we avoid the shortcomings or the dangers that revolve around this procedure. Such as, for example, that in order to have this IVF, we have to expose what is known as the awrah. And not only this, it's the awrah, it is the most private part of the private parts.
Of course.
So here we come to a fork of the road. Is it worth it? Is it or is it not?
Is it worth it for the woman or the man to sacrifice their modesty and their hayat?
Yes. Some say that it is not sacrificing the modesty, because when she gives birth, by default she has to expose this to who's ever doing the delivery. But again, it's an issue of to be balanced and to be weighed. They go on and say that there is a very huge possibility that mistakes could happen at labs. So instead of cultivating the right sperm or the right egg, things could mix up. And then a black couple would have a white child. They said, what is this? Or the opposite. And the color is not of importance more than the result of
an individual can end up having the child of his cousin or his friend or his brother by accident.
By accident, and this is why some of the scholars limited the permissibility of this procedure to doing it on the spot, not having the samples taken in the refrigerators and come after 3 or 4 days and then planting it. No, it has to be on the spot. Among the dangers that are very possible, that these places or institutes, these clinics or hospitals, they're profit-oriented. So they would want the woman to come out pregnant, regardless if it's possible or not. So this means that even if the donor or the husband's sperms are not up to the task, they would fabricate. They would get from somewhere else so that they would get the money for this operation, for this procedure. And this is what caused a lot of scholars to say that it must not be performed, the IVF, it must not be performed in commercial institutes or privately owned. It has to be governmental run.
Where profit is not a factor.
Which is completely a fact.
Barakallahu feekum. What about, and this is a very superficial question, but what about some people who, for example, would store that sperm, if some scholars allowed it, and once the husband is dead, inserting that sperm into the woman?
Well, this also was discussed and mentioned by the scholars in their meetings, and they said that this is not acceptable and it's not applicable because after the death of the man, the contract marriage is over, it's done. So by doing the IVF after his death would not actually be his own. It would be like fornicating. It would be like committing adultery. So they completely forbid this and they ban this, and this is something that it is not permissible, because imagine if someone dies and all of a sudden a wife comes up and says 3 years later that, listen, I have his sperms and now I'm conceiving his child. How would we know that this is his child and not the result of adultery?
Barakallahu feekum. So what is the Islamic ruling then on some people who did this, let's say, for whatever reason, out of ignorance, and they fell into one of the first 5 categories, for example?
This would not be considered to be a proper offspring of the person, because this is not his child. The sperms is someone's else. So this child cannot be called after him. Unless in a very narrow window of fiqh, where the man has the right to call after him whomever he wishes. So he can give him his name.
But this is a minor opinion.
But this is a very minor opinion.
So what's to be done with the child? Should they be given to an adoption agency? Should that couple raise that child?
Well, the mother is the mother, without any doubt, because the egg was her. She conceived the child. But the problem is with the father. He is not the biological father, and it was a result of someone's else. So he cannot be called after the person, and that this person should not treat him as his own child. So he should be called after the mother, as in the times of adultery. If a woman fornicates and bears a child, who is he called after? Definitely not the biological father, because he has nothing to do with it. He is to be called after his mother. And in this case, because of the misconception, because of the error and ignorance that resulted of this child, there might be a way to have this child called after the husband, who is not the actual biological father. And if he accepts this and he calls him after him, he's called after him.
Okay, so the ruling for the most part falls to the same ruling as a woman who committed fornication or adultery, and it kind of gets taken out of the whole contemporary issue because there are now direct rulings to dealing with it, or direct examples from the earlier generations.
Yes, but what governs this is that ignorance was prevailing. They didn't know that it was not permissible, or someone gave them the wrong fatwa.
So they're not sinful.
They're not sinful if they did not know.
Barakallahu feekum, ya Shaykh. We'd love to continue and discuss, but unfortunately we're just out of time. Join us again next week. Wa jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
You can try to hold back the wave, but they will always wash upon your feet. Two waters flow with a barrier in between, the salty sea and rivers fresh and sweet. Everything Allah commands to be will always become a reality. Everything Allah commands to be will always become a reality. Allah Ta'ala, Allah Ta'ala, Allah